Trying to conceive can quietly take over your everyday life. The meticulous tracking, waiting, and the monthly cycle of hope that ultimately ends in disappointment. For many women, this cycle often outlasts the initial months, stretching into years of unresolved waiting. It is a remarkably common reality. Globally, up to 15% of couples experience infertility. Within that statistic, roughly a quarter to a third of cases are categorized as unexplained infertility, meaning every standard test comes back looking completely normal. Without clear answers, what starts as a medical hurdle shifts into an exhausting, pervasive state of being that quietly touches every part of your routine. Conventional fertility treatments like IVF are life-changing for many people who use them, yet these treatments have steep costs. They require significant financial investment, frequent physical invasion, and enormous emotional endurance. Patients often hit a wall of treatment fatigue, feeling overwhelmed by the constant barrage of internal interventions and the growing stack of unopened medication boxes. When those conventional paths become too heavy, a new question arises. How can a woman support her body's internal environment in a gentler way? This search for a different path focuses on a sustainable, routine-based method of care that respects a patient's physical and emotional limits while addressing the underlying need. The 5 Essences approach offers a completely external method of fertility support. This method requires absolutely nothing to be swallowed, bypassing the digestive system entirely. Instead, you use a flat, stitched herbal pouch, worn externally at the navel and secured by a soft fabric belt. This illustrates the traditional Chinese medicine concept behind the placement. The Shen Kui point acts as a central anatomical hub at the navel. Fertility requires harmony between the kidney, liver, spleen, and heart, instead of an isolated reproductive glitch. By applying gentle external support directly to this central point, the goal is bringing the internal system into harmony, instead of overriding a localized reaction. Moving from the philosophy of this treatment to the practical reality, wearing the pouch easily integrates into a normal day. The specific timeline constraint is simple. Each individual pouch provides up to 72 hours of continuous wear. This timeline graphic breaks down the full cycle duration. By wearing 3 continuous pouches back-to-back, you create one steady, 9-day block of support. This passive, low-interruption routine stands in contrast to the high-stress nature of tracking daily pills and rushing to clinical appointments. The ultimate appeal here is steadiness. It allows a woman to move through her ordinary life of working, resting, and sleeping with continuous quiet support. To evaluate the clinical evidence supporting this external approach, we look strictly at a recent retrospective case series. The case series focused on 4 women, ranging in age from 34 to 45. These patients had severe prior conditions, including 5 to 6-year histories of infertility, recurrent miscarriages, and multiple failed IVF cycles. This clinical data dashboard visualizes the primary outcome. Following those long history timelines and IVF failures, you can see positive outcome markers. Documented pregnancies were achieved. A critical secondary outcome is also recorded. Across this entire series, exactly 0 adverse events were reported. While these documented outcomes offer hope for women with severe infertility histories, the most concrete takeaway is the demonstrated safety and the complete lack of negative side effects. We have to be clear about the data. This is observational evidence, not definitive proof derived from a randomized controlled trial. Individual results in these cases will always vary, and this approach should never serve as a substitute for proper evaluation by a fertility specialist. For women who are exhausted by the relentless cycle of clinical pressure, this offers a gentle, non-pill starting point. It provides a way to explore fertility support with care, patience, and absolute respect for the whole person. This is a complementary option you can explore alongside informed medical care, giving you peace of mind without adding a single physical burden to your digestive system. Educational content only. The page describes a complementary external herbal approach and retrospective case observations, not proof from randomized trials. Seek specialist fertility evaluation when appropriate.